Many patients are concerned about substance abuse and ADHD, and I think those are very valid concerns. There's a couple different things to tackle when we talk about this. The first is whether or not patients are more apt to use controlled substances in uncontrolled ADHD, and I think the answer is yes in some cases. I have known patients to be using drugs like cocaine to try to self-medicate. Some people are using caffeine, just gobs and gobs of caffeine. And I sometimes chuckle when I'm at the gas station. I see somebody with 3 or 4 Monster drinks. I almost want to give them my card and tell them to come see me, because it's a common way to self-medicate also. The other part of this discussion, though, is whether or not taking a medication for ADHD would increase your risk of substance abuse. And that we have a pretty solid answer on. The answer is no. So the data shows us that patients who are well treated, well managed for ADHD actually have a lower risk of substance abuse and addictive personalities, and that makes sense. As far as dependency on some of the medications we prescribe, again, I think if these medications are prescribed by someone who knows what they're doing and someone who partners with their patient and explains the risks of these medications, I think the risk is extremely low, even in children. And an interesting point also is self-esteem issues in children. So when kids are struggling with ADHD and they're having poor academic performance and maybe some social issues with their friends, that can make or have a drastic effect on their self-esteem and cause some anxiety and depression issues. And anxiety and depression are also factors that lead people to self-medicate with drugs. So if you're concerned about substance abuse, either in an adult or a child, I don't think that considering ADHD medication is a bad thing at all. As a matter of fact, I think it's a good thing. And I think that I would spend some time with your provider and really share some of the concerns. I think I would bring family history into the picture as well. If there's a family history of some addictive issues, I would bring that to light. And then talk about what it looks like to go on those medications or come off of those medications. Is there a titration period? Is there not? What would be some signs of abuse or some signs of dependency? And go over those things in great detail. And again, when you see your physician, you're not required to start a medication. You're just there to learn and to put a plan together and to feel partnered with. So that's our goal.